Hey, thanks again to John William Ball for that fabulous mantra music that you'll be able to enjoy when you go to the Yoga Challenge for ALS. All the details are at als.ca. And now we're going to talk about a community health center that's right here. We can take advantage of it. Maybe you already know about it. We've got the manager of health promotion at Stonegate Community Health Center, Joe Silva here. Good to have you here. I love hearing about places like this. It's an important thing to have in the community. So give us a little overview of what Stonegate Community Healthcare Center is.
Well, Stonegate Community Health Center is part of Ontario's healthcare system. We're one of 70-odd health centers across the province. We provide services to the residents living in the Stonegate Queensway neighborhood of southeast Etobicoke. We've been doing so for about 20 years and provide comprehensive primary health care, as well as a wide variety of health promotion and illness prevention programs for the residents in the neighborhood.
So primary health care would be what? Doctors' visits?
Doctors, nurse practitioners. We have a chiropodist who provides foot care, a dietitian, first point of access for anyone who has a healthcare issue.
Good stuff.
Yes.
Illness prevention.
Yes.
Love that. What sorts of things can you do for people?
Well, we do a wide variety of things. We recognize that health is more than just about when you get sick. It's actually about preventing things. So a wide variety of health promotion and illness prevention programs are available. We do things like exercise classes for women. We do senior social clubs. We have chronic disease management programs once in a while. We currently are offering a wellness program, for example, where people can actually come in, seniors and newcomers, participate in a health workshop by a professional, enjoy a healthy snack, and then participate in some physical activity.
Good stuff.
So it's a wonderful approach to preventing illness and disease.
And you really cater to all age groups, don't you?
We do.
You've got programs across the board.
We have an early years center, so we provide a wide variety of programs for families with young children ages 0 to 6. We do lots of things for children and youth, including teenagers, after-school programs and social recreational activities, right through to young families all the way up to seniors.
That is great. You even go beyond healthcare to help people with their housing. Tell me about that.
Well, we recognize that health is more than just illness. So there are those things called the social determinants of health, which impact greatly on a person and a community's health. And housing is a huge one. In our neighborhood where we're located, we're surrounded by 75 low-rise apartment buildings. So landlord and tenant issues, maintenance issues, tenant advocacy, eviction prevention, all of those kinds of things impact on how healthy you and your family are going to be.
That is so true.
So we have a housing worker on staff who can work with local tenants to address any number of those concerns and issues to help people stay healthy in their own homes.
That's wonderful. So people don't need to feel like they have to take on a landlord themselves. They actually have got some people in their corner who will help.
That's correct, yes.
And even finding a place to live.
Absolutely, yeah. We have folks walk in all the time saying, are there any affordable apartments around? So our housing worker will work with them to try to find something that's suitable to their needs.
Why do you think it's so important to have a place like this available to people?
Well, I've mentioned already, because health is more than just illness. I mean, health encompasses a whole wide range of things. So for a community to be healthy, the individuals that live in it need to be healthy. So it's one thing to address the primary care needs. Doctors and nurses do great work, but unless you can address those things that are external to your health care, like low income, like poverty, access to healthy, nutritious food, housing, unless you can address those things, then society or communities will never really be able to call themselves truly healthy.
That's right. Yeah. And is that what makes the Stonegate Community Health Center stand out apart from other community centers?
Well, I think it's what makes community health centers in general stand out from other ways of accessing health care in the city. Hospitals do their thing, family doctors do their thing, but as community health centers, we really focus on those social determinants of health. We try to provide comprehensive interdisciplinary care, so our staff all work together.
That's nice. So people are referring to each other.
Absolutely. Our physician will refer to our housing worker because someone may be ill, but the cause of their illness might be poor maintenance or mold in an apartment, something like that. So our doctor will make that referral to the housing worker to have that issue addressed, and that kind of sets us apart from some of the other healthcare providers that exist.
Yeah, that is so comprehensive.
Yes.
What if you don't speak English, or what if you're new to Canada, or to Ontario, your OHIP hasn't kicked in yet? What do these people do?
Well, our staff speak a variety of languages, and if we can't accommodate a language among our own staff, then there are interpretation and translation services available that we can connect with. We have many interpreters who come in and actually will work with clients and our staff to provide that language-specific service. Part of the other thing that makes community health centers unique is the opportunity to provide healthcare for people without OHIP.
Nice.
So newcomers, refugees, persons without status can certainly access our programs and services without cost.
That is amazing.
Yes.
So how do people get access? How do they get in there and get the ball rolling?
Well, I mean, for our community health center, and this is common to all health centers across the city and the province, you know, depending on where you live, just call up your local center. So in our case, you can call us at 416-231-7070 or visit us on our website at stonegatechc.org. There is an intake process, and all of the information and forms are available online for those who have access, or you can just drop in and visit us, and we'll be happy to help.
Where do you get the money to run? Are you funded by the government, or do you need donations?
No, as part of Ontario's healthcare system, we're funded through the through the Toronto Central Local Health Integration Network. And then we also receive funds from other sources. The City of Toronto grants us some funding to run particular programs.
How about donations from other people?
Donations are always welcome, yes. Something like our Food Access Program, which provides healthy and nutritious meals to local residents, is primarily funded through donations to our center. So everyone is welcome to lend a hand and
What if you're so impressed with this place, and why wouldn't you be, that you actually want to volunteer? Can you do that too?
By all means, you can visit our website or call us, and we can certainly welcome volunteers to help support our programs and services.
Love it. So for more information on getting access to these programs, or because you want to donate or volunteer, stonegatechc.org. Thank you so much.
Thank you, Val. My pleasure.
Thanks for all the great work you do there.